The hands are among the most vital parts of the body when it comes to daily living. However, as people age, mobility, sensation, and strength in the hands often decline noticeably. Symptoms such as finger joint pain, tingling or numbness in the hands, reduced grip strength, dry skin, and brittle nails can all make it difficult for seniors to perform basic tasks like getting dressed, holding a spoon, writing, or even shaking hands. To protect and maintain hand health, in addition to engaging in light mobility exercises, nutrition, particularly the proper and sufficient intake of vitamins, plays a crucial role. Below are 7 essential vitamins that experts recommend for comprehensive, inside-out care of the hands in older adults. Vitamin D, strengthening bones and preventing hand degeneration in older adults. Vitamin D is one of the most essential nutrients for overall health, especially for bone and joint function. In older adults, where the aging of bones occurs rapidly and often silently in its early stages, a deficiency in vitamin D becomes a hidden yet serious threat to hand health. Consequences can include osteoporosis, weakened joints, wrist pain, reduced grip strength, and even increased risk of wrist fractures from minor falls. The human body cannot produce enough vitamin D through diet alone. The primary source of vitamin D is sunlight, specifically UVB rays absorbed by the skin. However, as people age, the skin's ability to synthesize vitamin D declines significantly. This is compounded by a sedentary lifestyle, spending more time indoors, and wearing long clothing that covers the skin. Moreover, liver and kidney functions, crucial for converting vitamin D into its active form, also deteriorate with age. As a result, older adults are particularly vulnerable to chronic vitamin D deficiency without even realizing it. Vitamin D plays a central role in helping the body absorb calcium and phosphate from the gut and transport them to bones, including the small bones of the wrists, fingers, and forearms. These bones endure frequent stress during everyday tasks like gripping, opening doors, or cutting food. When vitamin D is lacking, calcium retention in the bones decreases, leading to bone thinning, weakness, and fragility. This explains why many seniors experience wrist or finger pain during weather changes or feel fatigue, tingling, or instability when trying to grip objects. In more advanced cases, a deficiency may lead to degeneration of the small joints in the hand, finger deformities, morning stiffness, and reduced manual dexterity. Beyond bone health, vitamin D also helps regulate inflammation in the muscles, tendons, and ligaments surrounding the hand and wrist joints. Chronic deficiency can lead to low-grade inflammation over months, eroding cartilage and resulting in painful hand or wrist arthritis. People who suffer from wrist pain when twisting bottle caps, writing for extended periods, or who are diagnosed with carpal tunnel syndrome often have lower vitamin D levels compared to healthy individuals. Moreover, recent studies have established a link between vitamin D and muscle strength in the hands. Deficiency impairs the efficiency of muscle fiber function, reducing control, slowing reflexes, and leading to hand tremors or fatigue during simple tasks like carrying items or doing crafts. This directly impacts a person's ability to perform self-care tasks, a key factor in maintaining independence in daily life. To optimize vitamin D levels, older adults should aim for gentle sun exposure in the morning, before 9 a.m., for 15 to 30 minutes daily, and incorporate vitamin D-rich foods such as salmon, eggs, cod liver, sun-dried mushrooms, or vitamin D-fortified milk. In many cases, particularly for those who seldom go outside, vitamin D3 supplements may be recommended by a physician, typically ranging from 800 to 2,000 IU daily depending on individual health status. Vitamin D does more than build strong bones. It plays a vital role in protecting, maintaining, and restoring the strength and function of older adults' hands. Ensuring adequate vitamin D intake is one of the simplest, most effective, and sustainable ways to help seniors maintain hand mobility, grip strength, and independence in their everyday lives. Vitamin B12, preserving sensory and fine motor function in aging hands. In the delicate motor system of the human body, the hands play a vital role in executing precise actions, grasping, writing, sewing, pressing buttons on a phone, or even just pouring water or opening a jar. These seemingly simple tasks rely on a tight coordination between muscles, joints, and especially the peripheral nervous system, which transmits signals from the brain to the fingertips. Vitamin B12 is one of the core nutrients that ensures this coordination is smooth, accurate, and uninterrupted. Also known as cobalamin, vitamin B12 is directly involved in the production of myelin, the protective sheath surrounding nerve fibers. Myelin speeds up and safeguards nerve signal transmission. In older adults, the ability to absorb vitamin B12 from food significantly decreases due to age-related gastric mucosa atrophy and reduced secretion of hydrochloric acid, essential for releasing B12 from protein-bound food sources. Additionally, common medications such as proton pump inhibitors, H2 blockers, or metformin for diabetes, and chronic gastrointestinal conditions can further impair B12 absorption without clear symptoms. The consequences of B12 deficiency often manifest clearly in the hands. Common symptoms include numbness, tingling, pins and needles sensations, or a crawling feeling in the fingertips. Some may lose temperature sensitivity or struggle to distinguish between hot and cold, posing a danger when handling heated objects or sharp utensils. In more severe cases, fine motor control becomes clumsy, making tasks like buttoning a shirt, gripping small objects, or writing difficult. Hands may tremble, and items may be dropped without understanding why. If left untreated, this can severely impact quality of life and daily independence. Vitamin B12 doesn't just support sensory nerves, it also plays a key role in motor control. Chronic deficiency weakens the forearm and hand muscles, particularly those controlling the thumb and index finger, responsible for most of the hand's fine functions. Older adults may find themselves unable to firmly hold a broom, scissors, a cup, or even open a door unaided. Some studies suggest that hand tremors in seniors are strongly associated with low B12 levels, especially when combined with anemia or chronic neuropathies. B12 is also involved in red blood cell production and oxygen transport, supplying nerve and muscle tissues in the hands. When deficient, seniors may experience muscle fatigue, cold or pale hands, and slower recovery from minor injuries or strain. For individuals with comorbidities such as diabetes, hypertension, or kidney disease who are at higher risk of peripheral nerve damage, proper B12 supplementation helps prevent progression of nerve complications in the hands and preserves motor function and reflexes. To maintain optimal B12 levels, seniors should consume B12-rich foods such as beef liver, salmon, eggs, milk, cheese, or lean red meat. However, for those with chronic illness or compromised digestion, B12 supplementation in the form of oral tablets or injections is often necessary. Sublingual, under the tongue, or intramuscular B12 delivery methods have proven effective in reversing hand numbness, sensory loss, and muscle weakness caused by B12 deficiency in the elderly. Vitamin B12 is the order keeper of the nervous system that governs our hands. By maintaining the stability of the myelin sheath, supporting both movement and sensation, and enhancing blood and oxygen circulation to the hands, B12 plays an indispensable role in helping older adults preserve hand function, from finger flexibility to precision in motion. Healthy hands symbolize autonomy, freedom, and dignity in old age, all of which B12 quietly upholds each day. Vitamin E, the anti-aging shield for soft tissue protection and pain relief in aging hands. When it comes to caring for the hands of older adults, most people think of bones and nerves, while often overlooking an equally important component, soft tissues, including tendons, muscles, ligaments, skin, and the connective tissues surrounding joints. These structures not only ensure smooth hand movements, but also serve as cushioning layers that protect bones and nerves from mechanical strain and oxidative damage. One of the key nutrients that maintains the resilience, elasticity, and recovery capacity of these soft tissues is vitamin E. Vitamin E refers to a group of 8 powerful antioxidants, with alpha-tocopherol being the most common and biologically active form. As a fat-soluble compound, vitamin E readily penetrates lipid-rich tissues such as cell membranes, muscle sheaths, and nerve coverings. Its primary function is to protect these tissues from damage caused by free radicals, unstable molecules produced during metabolism and the natural aging process. In older adults, endogenous antioxidant activity declines with age, accelerating the accumulation of free radicals. This makes muscle cells, skin, and tendons around the wrist and hand joints more fragile, prone to inflammation, swelling, and a loss of elasticity, resulting in greater risk of discomfort, cramping, or reduced dexterity in hand movements. A common sign of vitamin E deficiency in older adults is morning hand stiffness or wrist pain after repetitive motion or prolonged manual tasks. These symptoms are often rooted in low-grade inflammation of soft tissues, especially tendons and joint synovial linings. Vitamin E naturally suppresses the production of inflammatory compounds like prostaglandin E2, offering relief without the side effects of traditional pain medications. It also enhances peripheral circulation, improving the delivery of oxygen and nutrients to small muscle groups in the wrist, hands, and fingers, supporting quicker recovery after everyday tasks or light activity. Beyond tendons and muscles, vitamin E is also essential for maintaining skin health, an area frequently impacted by aging, environmental exposure, and seasonal weather changes. Older adults often experience dry, cracked, peeling skin, or even minor bleeding at the finger creases due to reduced natural oil production and moisture retention. Vitamin E helps hydrate the skin from within, stimulates collagen and elastin production, two structural proteins that keep the skin supple and resilient, thus reducing irritation from cleansers or dry climates. Additionally, vitamin E works synergistically with other nutrients like vitamin A and vitamin C to support connective tissue repair and accelerate the healing of minor wounds, scratches, or burns, particularly relevant for older individuals with slower recovery times. Its strong antioxidant properties help protect the structure of peripheral nerve cells, including sensory nerves in the fingertips, thereby alleviating symptoms such as numbness, tingling, and delayed reflexes. To optimize vitamin E intake, seniors should increase their consumption of natural food sources such as almonds, sunflower seeds, olive oil, avocados, leafy greens, fatty fish, and whole grains. For those with chronic conditions such as diabetes, cardiovascular disease, or oxidative stress-related medication use, vitamin E supplementation in the natural D-alpha tocopherol form may be considered under medical supervision to avoid overdose or interactions. Vitamin E is indispensable for preserving and restoring soft tissue, skin, and nerve health in the hand and wrist regions. In older adults, maintaining adequate vitamin E levels not only relieves pain, reduces inflammation, and softens tendons and muscles, but also significantly improves hand mobility, helping seniors maintain comfort, flexibility, and strength in the small, meaningful actions of daily life. Vitamin C, the rebuilding architect of connective tissue, tendons, and hand cartilage in seniors. As part of the natural aging process, older adults often experience weakened hands, reduced dexterity, increased pain, dry skin, and slower recovery from minor injuries. One key contributor to this deterioration is the decline in the quality and quantity of collagen, the structural protein that forms the foundation of tendons, skin, cartilage, and ligaments. Vitamin C is an essential nutrient for the synthesis, protection, and maintenance of collagen, playing a central role in keeping hands strong, flexible, and resilient to daily stress and damage. Vitamin C, also known as ascorbic acid, is a water-soluble vitamin best known for boosting immune health. However, its lesser-known yet critical function lies in the hydroxylation of proline and lysine, amino acids that are essential for collagen production. Without adequate vitamin C, collagen synthesis becomes impaired, weakening connective tissues throughout the body, particularly in highly active areas like the hands, wrists, and fingers. This can result in joint pain when gripping, weakened flexor and extensor muscles, difficulty rotating the wrist, or persistent pain during hand use. Another major benefit of vitamin C is its powerful antioxidant capacity. Hands, especially in older adults who often perform household tasks, use tools, or brace themselves during falls, are prone to microtraumas in muscles, tendons, ligaments, and skin. These micro-injuries trigger the release of harmful free radicals, which damage cells and promote inflammation. Vitamin C helps neutralize free radicals, protecting cells from oxidative stress, reducing chronic inflammation, and accelerating soft tissue healing, relieving pain and promoting recovery. In addition to collagen repair, vitamin C enhances the absorption of non-heme iron, the form of iron found in plant-based foods. Iron is necessary for hemoglobin production and healthy blood circulation. Better circulation improves oxygen and nutrient delivery to the hands, helping reduce coldness, fatigue, and prolonged muscle soreness. For seniors with anemia, poor blood flow, or a history of hypertension or vascular conditions, this role of vitamin C becomes especially significant. Aging skin on the hands is often dry, wrinkled, less elastic, and easily damaged, a clear sign of reduced collagen and elastin. Vitamin C stimulates the production of both proteins and supports epidermal regeneration, improving skin softness, resilience, and healing capacity. It also helps fade age spots, pigmentation, and discoloration, making the hands appear healthier and more vibrant, an often overlooked yet emotionally meaningful improvement for many older adults. To optimize vitamin C intake, seniors should increase their consumption of foods such as oranges, tangerines, grapefruit, guava, strawberries, kiwi, papaya, bell peppers, broccoli, and tomatoes. Whole fruits are preferred over juice to retain fiber and avoid blood sugar spikes. In special circumstances such as immune suppression, post-COVID fatigue, or delayed wound healing, supplementation with vitamin C may be beneficial. The recommended daily dosage is typically 500 to 1,000 milligrams per day and should be taken within safe limits to prevent digestive upset. Vitamin C is not just the body's shield against infections, it is the quiet architect of muscle, tendon, joint, and skin health. For older adults, a vitamin C-rich diet is the first step toward maintaining hand durability, flexibility, and comfort, helping them continue caring for themselves and enjoying daily life with greater independence and control. Vitamin B6, the signal command center that enhances nerve stability, sensation, and reflexes in aging hands. Every movement in the human body, from large gestures like raising an arm or rotating the wrist, to fine motor tasks like buttoning a shirt, picking up a grain of rice, or typing on a keyboard, is governed by the nervous system. In older adults, the motor and sensory nerves in the hands are among the first to decline due to aging, leading to common symptoms such as fingertip numbness, tingling, slight tremors, weakened grip strength, or reduced tactile sensation. In this context, vitamin B6, also known as pyridoxine, stands out as a vital nutrient that helps maintain the accuracy, responsiveness, and stability of the nervous system controlling the hands. Vitamin B6 plays a central role in synthesizing neurotransmitters such as serotonin, dopamine, and GABA, the chemical messengers that transmit signals between the brain and muscles. When B6 is deficient, these signals may become delayed or disrupted, resulting in slower hand responses, poor coordination, or even overexcited nerve transmissions that cause minor hand cramps or tremors. This is particularly evident in seniors performing delicate tasks like writing, unlocking a door, holding a hot cup, or pressing buttons, actions that quickly become compromised if motor nerve function is unstable. Another common consequence of B6 deficiency is peripheral neuropathy, a condition in which nerves controlling the hands and forearms become irritated or damaged. This can cause sensations of tingling, pins and needles, loss of fingertip sensitivity, or sharp pain in the palms, especially at night. In older women, this may also coincide with carpal tunnel syndrome, where pain radiates from the wrist up the forearm, weakening grip strength. Thanks to its anti-inflammatory properties and ability to protect the myelin sheath surrounding nerves, vitamin B6 can help reduce nerve damage, relieve numbness, and improve hand reflexes naturally and more sustainably than over-the-counter pain medications. Beyond neurological benefits, vitamin B6 also supports protein and glucose metabolism, key sources of energy for muscles, including the small muscle groups that control fingers, wrists, and the palm. Maintaining adequate B6 levels enhances muscular endurance in the hands, reduces fatigue from manual tasks, and helps prevent cramps or involuntary contractions during prolonged hand use. This is especially important for older adults who regularly engage in gardening, cooking, caregiving, or participate in crafts and social activities requiring hand strength and finesse. Vitamin B6 also supports the immune system, protecting hand tissues from inflammation, soft tissue injuries, and joint degeneration. As immune function declines with age, even minor cuts or tendon strains in the hands can heal slowly, become infected, or leave long-term effects. B6 stimulates the production of immune cells, aiding wound healing, reducing chronic inflammation, and preventing nerve complications caused by infections or minor trauma. To boost vitamin B6 intake, older adults should consume foods like salmon, chicken, liver, bananas, potatoes, pumpkin, soybeans, and whole grains. In specific cases, such as in vegetarians, individuals with nerve disorders, diabetes, or those taking diuretics or long-term birth control, vitamin B6 supplements may be necessary. A typical safe dosage is 1.3 to 2 milligrams per day, with a maximum limit of 50 milligrams per day unless medically supervised. Vitamin B6 truly functions as the signal control hub for accurate, responsive hand movement. By supporting nerve health, reducing inflammation, aiding muscle recovery, and relieving fatigue, B6 is indispensable in maintaining strong, agile, and precise hands in older adults. A consistent and well-regulated intake of B6 helps aging hands stay capable of the smallest tasks to the most meaningful moments of daily life. Vitamin K2, the calcium coordinator that strengthens hand bones, preserves joint flexibility, and prevents deformities in older adults. In the structural framework of the hands, bones serve as the mechanical foundation, providing shape, stability, and load-bearing capacity for the wrists, palms, and fingers. As people age, natural bone density loss makes finger joints more fragile, wrists weaker, and increases the likelihood of fractures from even minor impacts. While calcium and vitamin D are widely recognized for supporting bone formation, vitamin K2 plays a lesser-known but equally vital role. It ensures calcium is deposited in the right places, the bones, and not in soft tissues or blood vessels, where it could cause harm. Unlike vitamin K1, which is primarily involved in blood clotting, vitamin K2 is crucial for activating proteins that transport and bind calcium into the bone matrix. Specifically, it activates osteocalcin, a protein that guides calcium to collagen scaffolding in the bone. Without enough K2, this process stalls, leading calcium to accumulate in the wrong places, such as arteries, tendons, and joint spaces, resulting in arterial calcification, cartilage degeneration, and joint inflammation. In seniors, this not only weakens the hand's skeletal integrity, but also contributes to finger deformities, joint stiffness, and reduced hand flexibility, all of which increase the risk of wrist osteoporosis and disability. The bones in the hand and wrist are small and intricate, featuring many flexible joints that allow for fine motor tasks. When vitamin K2 is deficient, bone density can decline rapidly and unevenly, leaving older adults with pain when lifting objects, finger fatigue, or reduced grip strength. In some cases, they may even experience visible finger misalignment or deformation due to prolonged mineral deficiency. Vitamin K2 also activates another critical protein, matrix GLA protein, MGP, which prevents calcium from depositing in arterial walls and soft tissues. This indirectly supports vascular health, especially in the upper limbs, by keeping blood flow unobstructed to nourish the bones, joints, and nerves of the hands. Good circulation ensures bones receive enough oxygen and nutrients to repair microdamage and resist premature degeneration, thus enhancing joint longevity. An additional benefit is K2's synergistic relationship with vitamin D3. While D3 increases calcium absorption from the gut, K2 directs calcium into the bones, preventing vascular calcification. This combination is especially effective in preventing and managing osteoporosis in older adults, helping to fortify wrist bones and reduce the risk of fractures from falls, a common and serious concern for seniors. However, vitamin K2 is less abundant in the typical diet than vitamin K1. Natural sources include fermented foods like natto, fermented soybeans, hard cheeses, animal liver, eggs, butter, and certain red meats. For older adults with a limited or simplified diet, supplementing with K2 in the MK7 form, a highly bioavailable and long-lasting variant, is a safe and effective option. A typical dose ranges from 90 to 180 micrograms per day, ideally combined with vitamin D3 as part of a bone protection regimen. Vitamin K2 is not just a calcium coordinator, it is a guardian of hand-bone integrity, protecting against brittleness, sponginess, degeneration, and deformation. For older adults, maintaining adequate K2 intake is a sustainable strategy to preserve grip strength, wrist stability, and the skeletal health of the hands, an essential element for independence, safety, and quality of life in the later years. Vitamin A, the epithelial guardian that maintains healthy hand skin, speeds up wound healing, and boosts local immunity in older adults. While many vitamins focus on bones, tendons, and nerves, vitamin A stands out for its role in protecting epithelial tissues and strengthening the immune system, two crucial aspects in the care of elderly hands. Hands are not only tools for movement, but also one of the most exposed parts of the body, making them susceptible to dryness, infection, mechanical injury, and slow wound healing from even minor accidents. Vitamin A is a group of bioactive forms such as retinol, and retinoic acid, essential for maintaining and regenerating epithelial cells, including the skin, mucous membranes, and the lining of sweat and sebaceous glands. In older adults, epithelial regeneration slows and the skin becomes thinner, drier, more wrinkled, and cracked, especially on the hands, which are often washed, exposed to soap, household chemicals, and weather changes. A deficiency in vitamin A can lead to severely dry, peeling skin on the hands, small cracks at the fingertips or between fingers, causing stinging pain and increasing the risk of bacterial infection. Proper vitamin A intake promotes new skin cell formation and increases the secretion of natural oils that protect hands from dryness. It also enhances the self-healing ability of micro-injuries, such as scratches, small cuts during cooking, gardening, or playing with grandchildren. For seniors with weakened immunity, these small injuries can become infection sites or develop into cellulitis if not properly cared for. In such cases, vitamin A plays a key role in activating innate immunity, helping the body detect and eliminate pathogens on the skin surface, preventing infection spread, and minimizing complications. Beyond protecting the outer skin, vitamin A also strengthens fingernails, a keratin structure highly vulnerable to nutrient deficiencies. In seniors, nails often become brittle, split, rough, or discolored. A lack of vitamin A slows nail cell regeneration and weakens the keratin layer, making nails prone to breakage or fungal infections. Regular intake of vitamin A through diet keeps nails bright and strong, while improving the overall appearance of the hands, an aspect that influences not just aesthetics, but also hand function and protection. Another important but often overlooked benefit is vitamin A's synergy with other vitamins, especially vitamin C and E. These three form a powerful antioxidant barrier that protects the hand's skin from aging, UV rays, environmental pollution, and household chemicals. Vitamin A also regulates the production of white blood cells, the first line of defense against bacteria entering through hand injuries. For elderly individuals with conditions like diabetes, where wounds heal more slowly and are easily infected, vitamin A's role in local immunity becomes even more clinically valuable. Rich natural sources of vitamin A include animal liver, especially beef liver, eggs, milk, fatty fish, and orange-yellow fruits and vegetables such as carrots, pumpkin, sweet potatoes, mangoes, papaya, and dark leafy greens, spinach, kale. Older adults should combine both active forms of vitamin A, retinol from animal sources, and provitamin A, beta-carotene from plants, for optimal absorption without overaccumulation. Since vitamin A is fat-soluble and can accumulate in the body, high-dose supplements must be used cautiously under medical supervision, especially in those with liver conditions or metabolic disorders. Vitamin A is not just for vision or immunity, it is a critical protector of skin, nails, and healing functions in the hands. For seniors, sufficient vitamin A intake helps ensure that their hands remain not only functional, but also healthy and resilient, allowing them to maintain confidence, independence, and quality of life well into old age. To protect and enhance hand health in older adults, including bones, tendons, muscles, nerves, and skin, adequate supplementation of key vitamins like D, B12, E, C, B6, K2, and A is essential. These micronutrients not only support gripping and everyday functionality, but also help reduce pain, numbness, and increase mobility in a sustainable, natural, and comprehensive way.